Hi, I'm Jared Gardner, and today we're going to be talking about how to tell apart dense regular connective tissue, which is collagenous and fibroblastic in nature. It's the kind of tissue that you see in tendons, fascia, and ligaments. We're going to talk about how to tell that apart from smooth and skeletal muscle and nerve, because a lot of times people struggle with that. So here's a lesion from the finger, all right? And this is, I think, a Nora's lesion, a bizarre parosteal osteochondromatous proliferation. We'll have to save that for another video, but here we're going to focus actually on the background. See these dense bundles of pink? These are tendon or fascia. The tendon and fascia are kind of very closely bound together and close to the skin in the acral surfaces. So an easy way, it doesn't always work, but it works much of the time. An easy way to tell that you're dealing with dense regular connective tissue is this. Oh, but wait, that's wavy. That has to be nerve, right? Wrong. Nerve is not usually this wavy. If it's this wavy, dramatically wavy, I used to say this looked kind of like an accordion, and this is because the elasticity of the tendon or fascia kind of bunches up and causes these wrinkles in the collagen fibers. You can see this really nicely if you flip your condenser down. See, look, it's not quite as obvious here, but when you flip the condenser down, or if you kind of put your finger back and forth under the light source, you can see. But I always struggled with how to best describe this, and then my fellow Ed Fulton last year, he said this looks like ramen noodles. The ramen noodles when they're dry and come straight out of the package. So I like to dub this the ramen noodle sign of Fulton in honor of Ed Fulton. And I think it's a great visual analogy. And if you've never seen a package of ramen noodles, you need to go to the store and buy one right away. It's like 50 cents. And it's something that you need to have as a life experience to know what ramen noodles taste like and look like. So this is what I'm talking about. Now look, this is instant ramen, which everyone needs to try at one point, but if you've never had a bowl of real, amazing, true ramen, you are missing out. It's the most wonderful thing in the world. So this is what I mean though by ramen. Let's open this up here. And I'm not sponsored by Marichan, but if they watch this video and you'd like to sponsor me, that sounds great. That'd be fun to be sponsored by a ramen company. So this little brick here, look at that, the organized, super wavy, right? You can see how they're just arranged in these perfectly three-dimensional organized rows. And I think this is so much like what the very accordion-like folding of the collagen looks like in dense regular connective tissue. And I think it was brilliant that Ed Fulton thought of this idea. So that's why I'm calling it the ramen noodle sign of Fulton. And then once someone puts that into a paper and cites this video, it'll be in PubMed forever and honor one of my awesome former fellows. But if you see that, the super ultra waviness of the thin spindle cells, and look in between, it's pink collagen here. So when it's that wavy, when it looks like ramen noodles, or almost looks like little ridges and valleys, that's almost always going to be dense regular connective tissue. Nerve is not usually that wavy. It's kind of gently undulating, but rarely is it super wavy like this. So in general, I can trick residents all day long until they get used to my trick, and now that I have this video, I'll not be able to trick them anymore because you'll know, oh, it's super wavy, probably not nerve. So I don't really love the term wavy for nerve because of that, because I think it gets people to confuse this stuff, which is tendon or fascia. And it's really important to recognize tendon or fascia. When you've got a bunch of these bundles, you can be pretty sure that you're probably in acral skin or somewhere very close to the hands or feet, because that's where you have a bunch of tendon or tendons that are close to the skin surface. It's also helpful in telling in other sites that you're down near the fascia level or you're at an aponeurosis of the muscle. And sometimes you can see tumors growing off of this. And so a lot of information can be gathered just by knowing that that's what you're looking at. And also, of course, tumor involving this is not the same thing as perineural invasion. So it's really important to tell apart dense regular connective tissue from nerve and smooth and skeletal muscle. Okay, let's look at some additional examples here. Here we can see these pink bundles. And again, the main things on the differential for pink bundles of spindle cells are dense regular connective tissue, tendon, ligament, or fascia. That's number one. Number two, smooth muscle. And number three, nerve. So let's see if we can figure out what these are. Super wavy. And when we flip the condenser, we see that, again, that ramen noodle sign. Not quite as sharp and dramatic in this area. And again, it's not always present. It depends on the case, and it is kind of a fixation artifact. I think over here, we can see it a little bit better. So dramatically wavy, so regularly wavy, where you feel like the folds of the collagen. You can see them almost in 3 dimensions coming up out of the plane of section. So that's why I've got it a little bit out of focus here with the condenser flipped. I think it makes it easier to see that. So this is, I think this was also from near a joint space. This is with a big organizing thrombus in it, and I think it was near the knee joint, if I recall. So just another example. And here the actual bundles of the tendon are a lot more organized into individual fascicles. Sometimes it's more broad, the fascicles. Here's another one. This area I think was fascia, I think with some scar in the pretibial area. And this is what I'm talking about, a lot more almost sheet-like. It's such a thick, huge, broad zone. But even from lower power, you can see the waves, the ripples of the tendon and fascia here just coming up out of the plane of section in 3 dimensions. Really amazing. So sometimes it's just the collagen that folds like this, and then sometimes the nuclei get caught up in the action too, and you can see the nuclei look very, very zigzaggy and wavy here. So I think that, to me, this is much more wavy than nerves usually look. Now, maybe let's give the poor nerves a chance, because people love to say that they're wavy. So let's look at a nerve. So here's a big melanoma excision from either the face or the scalp. Where's the nerve? Ah, there it is. So here's a nerve bundle down in the subcutis. All right, and it's important when you're looking at derm path, the nerves that are going to look wavy are almost always going to be big, deep nerves, subcutis or deeper. The dermis has tiny, tiny little nerves that are so small that they don't really have a chance to look wavy, and you really, until you look for them, you might have trouble even recognizing that they're nerves. For example, this little tiny circle right here, that's a tiny nerve, and here's one over here. Here's a nerve right here, and it's wrapped in a little layer of perineurium around the outside, and you can see like 3 little Schwann cells in the middle of it there. You're probably like, I don't believe. But I promise, from looking at many, many immunostains, those are nerves. The nerves in the dermis are really tiny. If you see a big bundle of spindle cells in the dermis that's pink, it's probably not a nerve. It's probably a rector pili smooth muscle bundle or something like that. Probably some of those around here. Oh, there. These are not quite as big as I'd like, though, to show you. I'll show you in another case, but those are our rector pili here. So anyway, there's the small nerves in the dermis don't really come into the differential for waviness. It's the big nerves down here in the subcutis or deeper. And it is a little wavy, right? You can see that there's this kind of undulation, but to me, the waviness of nerve is much more gentle undulating. And I don't know, maybe that's subjective, but I'm gonna show you back and forth some examples in this video, and hopefully I can convince you. Let's see if we can flip the condenser here. You can see that there's a little bit of like this gentle waviness, but it kind of is very subtle and kind of these rolling waves, not the sharp, jagged ramen noodle kind of waviness that we see in the dense regular connective tissue. Here's another really helpful feature. When you have a nerve that's big enough to look at all wavy, like I said, it's going to be deep down, and usually those bigger, deeper nerves have some of the axons that are myelinated, and that's what we're seeing here. Those clear spaces along this nerve, those are areas where the myelin was and has now been washed out. Let's go in closer here and go out for a little journey talking about some esoterica. So what happens is the myelin's made of lipid, right? And when we process the tissue, the myelin washes out and it leaves just a white space, kind of like how fat washes out of adipocytes. This little line down the center is the axon. So that was the axon that had been myelinated. And then what are these little pink things here? These little pink triangles, or like kind of little lines coming out from the nerve. Well, I used to think that those were nodes of Ranvier. We learn about that in med school, but it turns out the nodes of Ranvier are really, really tiny. I think you can actually only see them under electron microscopy. If I'm wrong, you're welcome to leave a comment and tell me so. But someone actually on Twitter corrected me, because I think I had said that those were nodes of Ranvier, and someone said, no, those are Myelin incisures, or Schmidt-Lanterman clefts. So I asked some of my friends Histo and Jamie Chapman, and they said, oh yeah, that's actually what it is. They're both histology experts on Twitter. So this is another example of why Twitter is awesome. I learn things all the time on Twitter. Sometimes it's embarrassing because it shows that I don't know stuff, but we all have new things to learn. And I thought that was really cool. So try that out at your next cocktail party. See if your friends are impressed with your knowledge of Schmidt-Lanterman clefts. But what these are actually, my understanding is that as the Schwann cells myelinate the axons, the cytoplasm of the Schwann cell kind of gets caught up in the spiraling mass of myelin that's being laid down. And these little pink lines coming out are actually bits of cytoplasm of the Schwann cell. So it's cytoplasm from the Schwann cell that gets caught up and is kind of trapped in between each blob of myelin during the process of myelination. So how cool is that, right? It's the amazing wonders that we get to see in normal histology are really cool. But I would submit to you that this is not ramen noodle wavy. This is a nerve. So nerves that look kind of wavy will have almost always, you can see axons that are myelinated, and that the one with the Schmidt-Lantermans, that's a longitudinal section. The nerve kind of turned here, and look, this is what they look like in cross section. You see the little pink dot in the center here. That's the axon, and then the white space around it, that's myelin, okay? So usually you'll see myelination. That's one clue that you're dealing with the nerve. The other clue is that nerves are surrounded by perineurium. Especially you can see this when you got a big nerve like this. And this layer of cells around the outside right here is perineurium. And sometimes there'll be a little clefting artifact where the nerve will split away from the perineurium, and that makes it a little easier to see. The other thing, and it's maybe a little hard to pick up on this video, is there's often bluish myxoid material, or mucin, whichever name you like, hyaluronic acid, that's present in between the nerve bundles, and you often see that filling the space underneath the perineurium. So those are clues that can help you realize you're dealing with a nerve. Even the small dermal nerves, even though you don't see much myelination in them usually, they often do have just a tiny bit of that myxoid change. And again, it's a little hard to pick up on the video. Now here is a nerve that's small and dermal. And oh yeah, the nerves in the dermis, they like to run next to blood vessels like they do elsewhere in the body. This one actually does have some myelin. You can see the little myelin spaces there. But it's so tiny, right? Tiny little nerve, and it's got like one perineurial cell around the outside here, and possibly another one over here. Oh, that could be a fibroblast, hard to say. All right, so again, this might seem like esoterica, and it doesn't matter until you're trying to decide if there's perineural invasion that's going to get a patient radiation therapy. And then it matters a lot. So that's not the time to try to figure out your normal histology. The time is now, when you have a chance, when you know that nothing's on the line. Spend that time learning what normal looks like so that when you're faced with a hard case, you don't make a mistake. All right, so that's nerve. Oh, and then I think also, as an aside too, down here at the bottom, we have something else I just mentioned earlier, and this is skeletal muscle. So because we're on the head and neck, the face, or the scalp, skeletal muscle is a little closer to the surface here, and this is a layer of skeletal muscle down here, right around where the fascia would be. And sometimes people can get skeletal muscle confused with fascia, dense regular connective tissue from low power, but at higher power, it's usually a little easier to tell. For one thing, look at the color difference. And this slide's a little bit funny on the H&E, so it's not perfect, but usually there's kind of a deeper color of dark pink or almost reddish color to the skeletal muscle, whereas collagen is a paler pink color. The other thing is that the skeletal muscle fibers, the individual bundles here, they have, their nuclei are peripheral, right? So you have multiple nuclei per fiber, and they're all around the outside of each of the bundles. And you can see that here in longitudinal section, and over here in more of a kind of an oblique cross section. And then finally, of course, you can find the striations, and you can see the striations, I think, pretty clearly here in longitudinal section. You can see the cross striations and know that you're dealing with skeletal muscle. So not usually too hard to tell, but I think sometimes from lower power, I will see trainees struggle with recognizing that this here is skeletal muscle, and it's not quite as important. Well, it can be sometimes, but not always a patient care focused thing. But sometimes knowing whether you're dealing with fascia or skeletal muscle can help you with knowing how deep you are and your localization, things like that, okay? But again, the main point we're talking about is nerve. All right, let's see what else we got here. Okay. So now it's quiz time. We've got bundles that are pink, so we know it's either... Oh, I didn't show you smooth muscle. Okay, excuse me. Let's go and do that real quick while we got a chance. and then we'll do quiz time. All right, so here's a squamous cell carcinoma. I recently made a video about squamous cell carcinomas. It's like an hour and a half long, but it's all you could ever want to know probably about squamous cell carcinoma and actinic keratoses. I'll put a link down below. Right here in the dermis, this big pink bundle here, that's smooth muscle. That's an erector pili muscle. You can see it's anchored into the dermis over here, and it's coming down here, just attaching to the outside of the root of that hair follicle. The smooth muscle tends to have a unique pink color also, kind of a more, I don't know how to explain it, a brighter or more rich, I don't know the right word. It's a different color pink than the collagen though. You can see this is the pink color of the erector pili, and then in the background, that's the reticular dermal collagen bundles, and you can tell maybe the collagen has the brighter pink here, I guess. But in any case, with practice, you can see, and usually you don't get that waviness in smooth muscle, and I have a video about how to tell smooth muscle from fibroblasts and myofibroblasts. It's a short video, and I'll put a link to that down below. It's got a couple tricks and tips to help you tell those apart. But we won't rehash all that in this video. I'll just put the link and you can watch it. It's a short one. Okay, so anyway, that's erector pili. So now you've seen nerve and smooth muscle. I think I have one other smooth muscle slide here. Here's the H&E on this one's kind of a pale H&E. So it looks a little different. Look how much smooth muscle there is in the dermis. When you have this much smooth muscle in the dermis, anatomically, that means you're on the nipple or areola area, right around the nipple, or you're on genital skin, usually either the scrotum or the labia majora in females. Those are areas where you have lots of smooth muscle. In the genital smooth muscle, they tend to be lots of little tiny bundles. In the nipple area, which is where this was from, they tend to be larger smooth muscle bundles. And again, you can see the color difference of the smooth muscle bundles from the background dermal collagen. The color looks different here just because this H&E was done in a different lab than the last case. And so, you know, H&Es vary from lab to lab. And I do think that there's an area here that had a little bit actually of zigzaggy, kind of almost ramen noodle effect. The nuclei are very, very wavy here. And so, you know, artifacts can happen to anything. So it's not a perfect rule, but this is a nice general rule that if you see a lot of that ramen noodle stuff, you're probably dealing with tendon or fascia, not smooth muscle and nerve, but exceptions exist. All right. Okay, now quiz time. So here are bundles. You can see they're discrete bundles. We're down in the fat, so subcutis or deeper. So pick your answer. Is this nerve, smooth muscle, or dense regular connective tissue, tendon, fascia? Answer in 3, 2, 1. It's dense regular connective tissue. That's totally ramen noodle sign, right? Perfect. Even here in these bundles that you could think, well, they're kind of bundled like a nerve. There's no myelination, none of those Schmidt-Lanterman clefts. There's no perineurium around it, and it's so, so very, very wavy. Okay? Ramen noodle wavy. All right. And here's another one. You can see again bundles running here. It could be a little difficult over here because it looks like the nuclei are around the periphery of each bundle, so you could struggle to tell that apart from skeletal muscle maybe. But if you look closely, there won't be any cross striations here. And then areas like this, you can see we've got that nice wavy ramen noodle effect again. So this is also dense regular connective tissue. And the nuclei are just like crinkly, they're so wavy, right? All right, here's some bundles. What about these? Okay, choose your answer in 3, 2, 1. This is nerve, right? And it doesn't have the beautiful Schmidt-Lanterman clefts like the other one did, but you can still see there's bubbliness here. I don't know if this is artifact. or why it exactly doesn't look as pretty as the other one, or if there's actually something different about this nerve. But there's a lot of bubbly spaces that used to represent myelin. There is a gentle undulation or a gentle waviness to the spindle cells here, the Schwann cells, but they certainly don't have that ramen noodle effect. And you can see that the outside of each of these bundles is lined by perineurium. And there's this little clefted space with a touch of myxoid material in here around the outside of the nerve, separating it from the perineurium, which is another useful clue that you often see in nerves. So see, they're a little bit of wavy, but not nearly as wavy as the ramen noodle dense regular connective tissue. Okay, so does this apply to tumors? Well, or neoplastic things? Yeah, I think it does. So let's take a look. And I think that this is not only useful for normal histology, but it also can apply when you're looking at lesional tissue. So here's a skin biopsy. Let's see if I can get it right side up for you. And clean. Okay, there we go. Skin biopsy, spindle cell proliferation. Well, I thought there was a good area on here. Maybe it's the next piece. Yeah, there we go. So it's not nearly as dramatic as in the other lesions or the other normal that I showed you, but you can tell that these spindle cells, they have pink collagen in the background, and here at high power with the condenser flipped, you can see that they very much have that wavy ramen noodle pattern to the background collagen fibers. The nuclei are not all that wavy. Some of them are, but the collagen fibers certainly are wavy. And there's also this kind of bluish purple cytoplasm at each end of the nucleus. And again, that myofibroblasts versus smooth muscle video, we'll talk more about that. But this is a myofibroblastic process. This is scar. Okay, so that we've got parallel fascicles of myofibroblasts. Oh, there you can see some wavy nuclei there. So here, I think the ramen noodle sign and the intensity of the undulating waviness really supports that this is not nerve. This is actually probably a fibroblastic or myofibroblastic process. And I lump those things together. I think myofibroblastic and fibroblastic things are on a spectrum in general, and they often look a lot alike and they can stain alike. So when I see the ramen noodle sign in a spindle cell proliferation, it makes me think first and foremost that this is probably a fibroblastic or myofibroblastic process, either reactive, like in this case with a scar, or neoplasm. And that can be really helpful in sorting out my differential. Of course, immunostains can help solve the problem if you're thinking, is this neural or not? Because neural lesions can look a lot like fibroblastic lesions. I think, in fact, in spindle cell pathology and soft tissue pathology, I think that telling apart fibroblastic and myofibroblastic things from neural things can actually be quite tricky without immunostains in some cases. And I will point out that not all fibroblastic and myofibroblastic things are going to have the ramen noodle sign, but when you see it, it tends to make me favor fibroblast or myofibroblast rather than nerve, okay? So here's an example of an actual neural tumor. Okay, this is a plexiform. I can't get any lower power than this. This is a plexiform neurofibroma from a patient with neurofibromatosis type 1. And I have a whole video about neurofibromas and another video about schwannomas. I'll put links to those down below. So that'll really go in depth about how to diagnose neural tumors. But note that much of this tumor doesn't look very wavy. I mean, a little bit of wavy, but certainly no ramen noodle, none of that organized, dramatic waviness that we saw in the dense regular connective tissue, okay? The nerve, the Schwann cells that are making up the lesion, some of them have kind of curved or bent or buckled nuclei, gently wavy nuclei. My mentor, Mark Edgar, liked to say that they kind of have an S shape, some of them. And I like that. I think that's nice. Or they look like the tab on a can of Coca-Cola or other soda that when you pull it up, it's kind of bent in the middle. And again, you can go look at the neurofibroma video to hear all about Schwann cells and all the different types of tumors they produce. But really, we don't have that dramatic waviness. There's a little bit of wavy collagen in the background, but it's very disorganized. It's not that uniform waviness like we saw in the scar tissue, for example. And then over here, I think there's another area that's a little bit more wavy over here. So that area is wavy, I will give you that. but it really doesn't, it's a different kind of wavy, right? This looks more like the nerve I showed. This kind of gently undulating, gently up and down. It's not that dramatic, zigzaggy, ramen noodle looking waviness. Here's a spindle cell proliferation. Let's see from low power. Now this is all tendon and fascia out here. I think it's tendon actually, we're from the foot. And I will point out that tendon does not always have the ramen noodle sign either. The ramen noodle sign works best on tendon when it's cut in longitudinal section. This tendon is cut in cross section. So you really don't get any of that waviness. You can see kind of cracks. The cells don't look nearly as spindled. They look a lot more almost round or oval, and that's because we're cutting across the cell rather than longitudinally. So learning is things that run in fascicles look different when you cut them longitudinally versus in cross section, and that's an important three-dimensional distinction to be able to make, just like I showed you with the skeletal muscle. The same thing is true of tendon and fascia, that these are all in cross section here, so you get these little cracks that are separating each of the individual fibers and bundles of dense regular connective tissue that when you cut these in longitudinal section, they tend to show that waviness, that ramen noodle sign, but not when they're in cross section. And this stuff here can be a little hard to tell apart from skeletal muscle at particularly low power. At higher power, I think it's a little easier to see that you don't have well-defined fibers with a peripheral rim of nuclei around them. But at low power, I definitely have seen trainees struggle, and I even occasionally thought, oh, that's going to be muscle. Oh, whoops, I was wrong. It's actually cross section of tendon. Looks different, okay? But over here, arising out of that tendon, we've got a tumor composed of spindle cells. And where's the piece I wanted to show you? This part of the tumor right here. Look how wavy that collagen gets. And the spindle cells get that wavy too. And again, it's got that ramen noodle effect. It's not as dramatic as you see in normal tendon or fascia, but you can really tell right here that that's what's going on. And so for sure, this thing is going to not be a neural tumor. It's going to be a fibroblastic or myofibroblastic tumor. And that's what it is. This is actually plantar fibromatosis. And I have a video not about plantar fibromatosis, but about desmoid fibromatosis, and there's a lot of similarities to these tumors histologically. I'll put that video link in the video description down below as well. How about this lesion? It's a nodule. See if I can get the light right. Some gentle waviness, but a lot less organized than what I just showed you. So this is a neurofibroma again. And I feel like in schwannomas, you really don't get much waviness at all, except that the nuclei are a little bit bent or S-shaped. But here in neurofibromas, there tend to be little fine collagen bundles in the backgrounds and the so-called shredded carrot effect. But when you look at them, they are wavy a little bit, but it's a lot less organized, a lot less like a package of instant ramen noodles than a dense regular connective tissue lesion, or fibroblastic lesion would be. And then one last one, we're in the skin. Got a lesion in the dermis, spindle cells. Totally ramen noodle effect there. This is also scar. So in the fibroblastic, myofibroblastic category, not the neural category. I initially had intended this to be a 5-minute video, but as you all know, it's really hard for me to be short and not long-winded, but hopefully you can thoroughly tell apart fibroblastic, myofibroblastic things and dense regular connective tissue from neural things and nerves, and then also that you can keep in mind how smooth and skeletal muscle look and how they can sometimes come into the differential. Again, I see a lot of people struggle with this, so I wanted to make a really definitive video to give you a lot of examples, and I hope that this helps you in your training and in practice. If you like these videos, please click like and subscribe to my channel. That's always helpful for me, and please leave comments or questions down below and recommendations for other topics you'd like me to cover. Thanks for watching.